our head technician here at Nova Cat Clinic, and today we were going to talk to you about feline hospice and palliative care because it's something we deal with a lot. We get a lot of questions about, and we thought we could answer your questions. So first, in case you don't know this, Ellen used to help a lot with people hospice.
Yeah.
So she has a lot of expertise in that. Do you want to tell us what hospice means to you?
Well, I
or mean, what, however you'd like to start the conversation out.
Well, hospice, it basically is a way of allowing a life to cease to exist in a non-painful manner, and making sure that they're comfortable and they're surrounded by people who they love, or just in a comfortable room, because you can have hospice at home, you can have hospice at a hospital, you have hospice facilities. Basically what it does is it alleviates a lot of stress on the family by allowing them to go on their day-to-day life on if they're actually able to function in a day-to-day life. It's a very stressful thing. Dying is incredibly hard on everybody, including the family who's taking care of the person, and hospice care alleviates a lot of that emotional and physical drainage on the family. Same way with pets. A lot of people don't realize the amount of emotional stress it takes on the person who's actually caring for their cat, who they've had for I don't know how many number of years. Could be a few weeks, could be that attached to the animal, regardless. And including all of the physical aspect of it. Like, you have to clean up after this animal constantly. Do you have to hand feed them all the time? Mm-hmm. The same way with people, you're constantly cleaning and caring and medicating for them until all life functions just stop. Mm-hmm. Fortunately, in veterinary medicine, you guys are able to actually help them along the way and make the choice. Not many states here in the United States, only a select few, allow quote-unquote assisted suicide for these special hospice cases.
Right. I remember when I was with my grandfather, when he was on his hospice and then transitioning, I remember standing by him when he was, one of his last days, thinking in my head how we were so lucky to be, and that was before I was in vet school, but I was thinking how lucky I was going to become a vet and I would be able to help stop this horrific pain. Because I can only imagine how difficult it is to watch people go through that every day, and there's only so many things you can do to help. But not to turn this into a political discussion on what people think you should or should not do in that situation. A lot of people have to understand that when you do choose to go into hospice, or you put your patient or your cat or your loved one in hospice, it's not that you're not going to treat them anymore. You're going to continue to treat them, but you're not going to do heroics. So for example, we have a patient next door who has pancreatic cancer, and we've been keeping her comfortable with pain meds and steroids. And one of the things we were thinking about today is do we need to do x-rays on her to really see how things have progressed? Do we need to do blood work to see how things have progressed? The answer is kind of no, because it's not going to change what I do. But when we were talking, we were like, but maybe we should do a urine culture and make sure she doesn't have a urinary tract infection, because I wouldn't want her to have something that's an easy treatable thing that I don't treat if we're going to continue to go forward.
Right, and UTIs can be uncomfortable.
Right.
So we want to focus on comfort.
Exactly.
And then you also have to look at the aspect of when they're in hospice care, it's are they still eating? Are they still interacting with the family? Are they making an effort to still be around? A lot of cats that tend to get very sick tend to seclude themselves, and that's usually one of the signs that we know that maybe somebody's starting not to feel good and we need to address some of the issues going on. But like you said, in hospice, it's just not going out for heroics, but it's also managing their day-to-day life and making sure that they still have their top 5 things they like to do.
Right.
We know Regina likes to lick Chrissy all the time.
All the time.
This cat would probably lick her raw. We know she enjoys eating. We know she likes sitting on the bed. She has her routine, and when that set routine starts to falter, then we know that maybe the disease is progressing, as you said, and we're not going to go ahead and look further into it unless Chrissy would be I kind of want to see where we are and just see how bad things are and help me make an informed decision for her and be better for it. Because she could have a really good day and then she can have a really bad day. Well, once you have like more bad than good, then the wheels need to start turning on a decision that you want to do, but nothing needs to be rushed in hospice.
Right.
And that's
Unless
one of the
there's
big
like
things.
an inciting cause, like if you find them agonal on the floor, you're going to do something like that. We were talking earlier about how hospice is also kind of a conversation where we say it's okay, like we're sorry that your cat's going through this, we're sorry your loved one's going through this, but it's okay if you don't want to keep treating.
Right.
If you have an incurable disease and you're not comfortable with that, or the disease process that is ensuing is a lot of home care and you're out 18 hours every day and you're traveling a lot and the cat doesn't do well going to the clinic or doesn't, it's okay. And it's a conversation you need to have with your veterinarian because it's something you should decide together. Because the main thing is we just want everyone to have the best quality of life for when they're here.
Right. And having a very sick pet in hospice care can be incredibly emotionally overwhelming and draining, not just on the sole person, but it kind of like branches out to family and friends as well. So if it's the family cat or the family dog and it's mom who's mostly taking care of the cat, well, maybe she is a little more overwhelmed if there's small children in the house. And so that cascade effect of stress kind of flows down onto everybody. And so sometimes we have to be the group that goes, okay, maybe it's time to slow things down, and maybe it's too much for you at this point in time. And so even a bigger conversation occurs on what are you able to do? What is your emotional stress feeling like that day? Do you feel you're going to be able to continue? Like, you need to actually start planning out things to make it easier. But most people wait till it's almost till it's that time because they don't want to make that decision. They're used to seeing people dying on their own, and then that's it. Unfortunately, pets don't like to die in very nice manners.
Usually
they tend to go out with very operatic ways.
Usually they don't. Sometimes they do, but most of the time
they don't. That's why we always say, we're here to help you and make the transition a lot easier. So I mean, this is when we actually start treating our clients a little bit more like family. It becomes a very, very intimate conversation versus it just being straightforward and here's how it is. And there should not be that emotional detachment. And I feel a lot of times when I see on Facebook or Instagram when a certain posts up, I would get a lot of comments of saying how emotionally detached sometimes a doctor or even just the veterinary group can be when their pet is going through this. And you have to remember that how many of these do we do? A week, a year, a month, whatever. It's emotionally draining on us as well.
Well, and then not only that, but it's we're trained to be a medical staff. We want to fix things, and we can't fix that. But maybe it is fixing in a different way. A lot of people say euthanasia is the final pain treatment, which if you've done a few of them, and you see how sick a pet is and they're holding their body together and they're so stressed and then all of a sudden they're sedated and they just look so relaxed. It is the final pain treatment. It's hard and it sucks. It's difficult because it's hard, but a lot of times it's the right decision. And don't forget that, maybe the veterinarian seems detached, but they're probably doing that to guard themselves.
Not only to guard themselves, but also to protect the client. Because there's a certain amount of vulnerability that we don't want to emote to our clientele. We're supposed to be the ones that are supposed to be together for you and make sure that everything is done perfectly. That doesn't say that whether or not you go home in the evening and then you're like, man, this day was just the worst.
And the other thing is usually after you have a euthanasia, you have to go see somebody after that. You don't want to walk into that next room and people are understanding, but at the same time, you need to have an emotional connection with your clients, period. And if you're sitting there crying and they're telling you how they just got this new cat and that it really likes to eat, lettuce or something, and you're not
100% there for that other person.
That seems really impersonal, and that's
Right.
not going to be a good connection for you to help that new pet.
Right.
So they might seem detached, but they might not it might just be guarding themselves, and you don't know what that veterinarian is going through. I know right now sometimes doing a euthanasia is really hard on me because both of my cats are technically in hospice, and that's, sometimes I'm sitting there and I'm like, okay, you gotta kind of put your wall up because you need to be here for them, and you can deal with you later, but that means that I'm not as open,
Right.
which is fair because I shouldn't be. There's certain parts of yourself you can't always be there for everybody, and that's a lot of why there's caretaker fatigue. The people who are caring, as you were talking about, how you have to watch your emotional stress level. It's hard if you have any older family member that's gone through hospice, or if you have a family member that has Alzheimer's or dementia or something like that. It's really hard. So I think all of the things Ellen's saying is extremely valid to make sure that the people who are involved, this is a family decision. Whether it's just you and your pet, and that's your family, or if it's bigger, you need to have everybody's needs met during this process,
Right.
because otherwise it's a hard thing to go through, and it's really hard if people aren't getting their needs met.
Right. I remember, and this actually even happened to me personally with one of my cats. As I remember when we were working with some people, I distinctly remember I was doing something in the kitchen at a client's home, cleaning up something, and she was basically like, I can't wait for this to be over. Like, will he just please die already? And I remember like stopping and being like, all right, do you need to go take a walk? Do you need to go do something? Do you need me to just stay here a little bit longer than what my shift is for, so you can go take care of yourself? And she did. She left, and she thanked me and everything. And I think she just needed more of that break, because you're constantly looking at this person. And sometimes in hospice, you can be there for hours. Sometimes it's days. Sometimes it's weeks. Because death is hard and it comes on its own. And I remember when my cat Goblin was really sick, and she had bladder cancer, and she was constantly peeing blood and everything all over the house, and like caterwauling all night long, and we couldn't control her pain anymore. And I remember when I brought her into work, and we did, because I needed to know, like, is this it? And I had her sedated, and we did an X-ray on her, and her tumor was like enormous. And right then and there, I was like, no, I'm not doing this anymore. This is not fair to her. My husband wasn't there, and my daughter wasn't there, but and they were upset that I didn't bring the cat home to do the final goodbye and all this kind of stuff. But at that moment, I had to make that decision. Was like, this cat is miserable when she comes to the vet's office. She's been miserable for months now, and I'm like, it's time. And I made that decision, and I felt like an overwhelming sense of relief when it was all done, because I knew that I made the right decision, even though I was gonna have to go home and answer to like, why I didn't bring the cat home with me. And I was like, well, I did the right thing for her, not for me, but for her in the end. But it was always that sense of like, okay, now they're safe. And that's how, a lot of people tend to feel.
Right. I remember that day. I hugged Ellen. Ellen doesn't like getting hugs, but I wrapped her and I was like, I'm sorry, I just can't hug you. She's like, fine. So are there any questions or comments?
Yeah, I also want to say we have Miss Amanda Dickerson watching.
Hi, Amanda. You mean the future Dr. Amanda Dickerson.
As well as current Dr. Christina Bazemore.
Hi, Dr. Bazemore.
And Miss Gross has a question.
Hi, Miss Gross.
She says, do you think it's better to say the final goodbye at home with the other pets around, or does that create more stress for the remaining pets?
I actually, in all honesty, I would say this. I think it makes a big difference for those other animals in the home to know that that animal has ceased to be, versus they left the home and suddenly they're not coming back. Like they know that that animal is no longer there. They're not stupid. They're actually incredibly brilliant. And I mean, if you look at the studies with like the chimps and everything on how they have like their own little rituals and stuff. Even cats and dogs have like their own rituals. And the whales too. They'll stay with the dead for just a little bit to kind of go, okay, we know everything's happening, and they mourn their own different ways. And I think we don't let them mourn the way that they should most of the time because of the lack of certain conveniences. Like, it's very convenient to come to us to have things done. But now the nice thing about it is there's a lot of home mobile euthanasia groups that are willing to make that more intimate connection happen. I know when I had my 2 cats euthanized at home, the house transitioned a lot easier with the other cats knowing that those cats weren't there anymore. When I didn't bring Goblin home, Benny was like a wreck for like weeks. Like, all of a sudden he was like, she's just not here anymore. My routines suddenly changed versus this letting him go, okay, she's not going to come home anymore. I mean, how do you feel about that?
So I have mixed views on it. So besides Lap of Love, and there's also some other veterinarians like Dr. Beth Baguette, Dr. Brown does some home euthanasias as well. So when my dog Rocky was really sick, my kitty cat Shuggy, her name's Mashugana, Ellen knows her well.
Yes, she ruined the I-131.
She ruined the I-131. She just sprinkled cat litter all about.
Radioactive cat confetti is what it was.
So Shuggy, we were all sitting there, and I was saying that I thought it was time, and Shuggy walked over to Rocky, cleaned his face, groomed him, walked over to the other side of the room, turned around and just started hissing. Like, I'm done, he's gone, it's over. So at that point, I was like, okay, let's take Rocky to the vet. I'm sad, but it's time. Sometimes I think it's better for the house, for the pet not to be put to sleep at the house, just because it can be hard on the natural flow of things, like if there's kids or if it's harder on the survivors. You know, like for me, I don't know if I can have my dogs or my cats right now. I don't think I could have my cats put to sleep at home. I might sedate my cat and then take him somewhere when it's time, because I don't know if I can look at that spot every day. Like, to me, I might look at that spot every day and be like, that's where my cat was put to sleep. That's really hard for me. And I know that I should put the pet's needs before mine, but I'm the survivor. So for some people, I think it's better for them not to have it done at home. In terms of my cats, they don't like each other anyway. So I feel like whichever one goes first, the other one's just going to be really happy. But if there is a strong bond with them, I think it might be better for the pets to be home. It's all very individual. And the other thing is if your cat hates going to the vet, tries to kill people, like my cat, is it really fair that their last moments are going to the vet being stressed? You know, like, I'm a vet, so I could take my, we could take drugs home and I could sedate him and then take him somewhere if I have to. Or maybe I'll just do it in the community room. I don't know. I'm kidding. But, I think it's not just about the pets that are surviving, but also the people, because, like, for some people it might be really hard.
Right.
To look
Everybody
at
processes death very, very differently. Some people are extraordinarily open and accepting of it. A lot of people aren't. So some people just are not, I don't want to say emotionally mature for it. I don't think there's like a certain type of maturity you have to have for the concept of death. But I think a lot of it is not being taught properly on what death is. Like, there's a certain flow, and you're actually taught that it's okay, this is how it goes and everything. So I can tell you in my house, like with my daughter and everything like that, she is more accepting, and it doesn't, I don't want to say it doesn't affect her. I want to say it doesn't become an emotionally obstructive portion of her life. She doesn't, I guess, become like just emotionally unaware for like weeks on end. Like, she doesn't like hold on to like the concept of we did something wrong, or this animal, we could have done more to it, or now I'm going to die. Like, there's none of that concept there. It's like she was taught properly, like, this is the process of death, and then this is how it happens. You're safe right now. Everybody does die eventually, and that's something you need to understand. But like, I want to say she's more emotionally aware of what's going on versus someone just not really kind of understanding the concept and being more of on the level of, I can't handle it, and don't ask, don't tell kind of mentality that's there. And it's like, I don't want to know. I just want to be told that everything's done, and then they process their emotional needs a different way.
Yeah.
So.
And it also could be because you have all those little kittens at home, and you know they don't.
Oh
own
yeah,
it,
I mean
and
like all the time. I mean,
Right.
we're constantly surrounded by the concept of death at home, and it's like it's a bummer. But we knew many of them were like really sick, and we cannot save everybody, despite how much medical care is provided.
Right.
So we always have to be aware that this is always like a fact that we
Yeah.
might have something happen, might have an event, and we get up in the morning. Did the kittens make it? No, it's one passed. I'm sorry. Okay, yeah, I knew.
Yeah.
I knew it was gonna happen. Yeah, it's a bummer. It's sad. I lost a lot of sleep, even though I don't want to say like I lost a lot of sleep over that. I lost a lot of sleep, and then I'm emotionally drained because of it.
Right.
Because I was trying to fix something, and I
Right.
don't want to say I failed at it.
Right.
Just we didn't succeed
Right.
in helping this patient because their poor little body was just too far gone.
Right.
They couldn't do it. We did everything we
Yes.
could, but it can be incredibly emotionally draining depending upon what it is. And then I still come to work with a smile on my face every morning, and they're like, "How's that kitten?" And I'm like, "It's not in the incubator anymore. It passed."
Sad.
And that's what it is. And you just have there's another life that you have to focus on.
Mm-hmm. And I think sometimes also with like older pets, like I remember a funeral I went to like 6 or 7 years ago, a friend's funeral. Somebody said, is it harder if a child passes when they're young or when they're older? And the rabbi said it was harder when they were older because when they're younger, you just have hopes and dreams of what they're going to be. And then when they're older, you see what a person they turn into, and then you're frustrated that they didn't get to go out the rest of the way. So I think it also, death is different for everybody.
Yeah.
Everybody's religious views kind of play into it and what they need. But I think the most important thing is to figure out what your family needs and what your pets need,
Right.
and to do the right thing by everybody. Because if you don't have everybody in agreement, like even though it was hard on Scott and Olivia when you didn't bring Goblin home, there's also kind of the understanding of, but it was what was best for Goblin.
Right.
So everybody was like, they got to be okay with that. Whereas some people are like, oh, I need the ashes back. And some people are like, I don't need the ashes back. And some people are like, I need the ashes turned into something special for me to wear on my neck. And some people are like, I need a footprint here and a footprint here, and I want to have a funeral for my cat and do all these things. So the main thing is that everybody's needs are talked about and you sort it out, because when it happens, if it's not like a sudden thing, it's going to be hard at that point. So try to figure it out beforehand. Try to figure out if you want a mass cremation or you don't want a cremation, or if you live somewhere where you're allowed to bury things and you want to bury it, or if you need a plot at a pet cemetery, which I have not seen that new movie. That's going to scare me. Ooh, I never saw the originals. I can't do
It was like the time, like a couple of years ago, I actually did the 3 cat funerals within 2 years
Yes.
span.
Ellen knows how to do cat funerals. If anyone's in the area and you need a real cat funeral, she has a friend who will embalm them. And they had a viewing and everything. And for that family, that's what they needed. And that's great that they got what their needs were. Because even though the process is hard, knowing what you need and doing it will make it better for everyone.
Right. And it's really important for I think for the clientele to be really honest with their veterinarian on what their expectations are during the whole entire process. And I think a lot of clients don't want to feel that vulnerability of being very honest with that.
And if you don't know what your needs are, talk to someone. You can figure it out. Because I know, for me, sometimes I'm like, what do I need in this situation? And you really have to, and I always call somebody I trust to talk it through. But if you're not sure, talk through it, because there's nothing worse than making a decision and not being able to go back on it and then having regrets about it. Because if you don't get your pet's ashes back, you can't get them back. They're gone.
Yep.
If you don't get a footprint, it's gone. If you want to, a fur trimming, you need to try to sort that out before, or at least talk about it during, so you don't make any final decisions that you can't go back on.
Right, and there's no judgment on the expectations of what's going on during the whole entire process of hospice and aftercare, etc.
No.
I mean, we've seen pretty much all of it.
Yeah.
So,
I know at a clinic I used to work at, someone used to make comments whenever people didn't choose a private cremation, because they're like, oh, they just don't want to spend the money on their cats, on this. And then I remember after the third or fourth time when I I just looked at them and I said, you know, I have never gotten any of my pets' ashes back because I'm Jewish and I don't believe in cremation.
Mm-hmm.
And they were just like, oh. And I was like, yeah, you don't know.
Mm-hmm.
It's not about the money.
Right.
I mean, maybe it was for them, but maybe it was more that they took that money and did something else.
Right. What they also don't realize, especially like in my situation, I think I have like 17 or 18 urns in my house now. Because like one day, when I pass, I'm gonna get mixed with all of my animals, and then they can make a gigantic diamond out of me or a paperweight or whatever. And then watch this: if I got made into a paperweight, I'm gonna end up at a garage sale at some point in time.
No, you won't be in a garage
So,
sale. You won't.
but if I got made into a diamond, people will wind up keeping me. But it was like, so if I have all these urns of my pet's ashes at home, and then I finally pass or whatever, and my family's gonna be like, what are we gonna do with all this stuff? I mean, so these are like things that people need to continue to think about.
They'll be like, oh, Ellen really liked it when she went to England. While we're flying over the pond, we'll just dump them over or something.
Right, so I was like, these are all the other things that people don't realize is like, these may be your expectations, but then what happens after the fact, after you go, and then they're cleaning out your home or whatever, they're like, what's this box? And they're like, oh, it's fluffy. Like, what do we do?
Yeah, so that's another good point. Like, if you have all your pet's ashes or something, you might want to say what you want done with them in your will. Like, if you want them buried with you or whatever is going to happen to you, you might want to have a plan. Are there any other questions, Sarah?
Yes. Stacy Rivera asked, how do you transition the client conversation from curative treatment to offering the option of palliative care / hospice?
So what I usually say for most things is I usually say, if we want to do everything, this is what we would want to do. I usually try to have 3 plans, if possible. I have like A, B, and C. And so if we want to do everything, this is what we do. If we want to try to do some things, this is what we do. And then if you're not sure you want to treat this, that's okay. Why don't we talk about how to make the pet comfortable?
Right, but when you put your plans out, do you say, this plan we can do everything, but we still have a high mortality rate? We can do plan B and then give them an extended period of life, et cetera. I mean, do you sit there and say, this is absolutely curative, this is middle ground of we can just extend their life by X amount of times, or we're gonna just say we'll put a cat with kidney disease, like stage 3 kidney disease.
Okay.
So we have a cat that needs to be diuresed, needs to have an ultrasound, probably needs to be in hospital for several days to try to see if we can get some numbers changed, but the numbers really might not change, and the outcome of death still might be there very soon, versus B, we can keep them comfortable and do sub-Q fluids and change some diet, etc. It's not doing the extreme. Or C, here's some sub-Q fluids for today, here's some pain management, see you in a few days.
So usually what I say is like, I'll have my A, B, C, and in my head I'm like, am I going to cure this? Like, is this curative, and is it a high likelihood of I was trying to say curative, but that's not the right word. A high success of curing this. Like what I try to do is I first start in my head, and maybe this is because I'm a doctor. I'm like, what is the prognostic indicator? What can I do? Do I have a high likelihood of fixing this? If so, then I'm not going to push anybody anywhere, but I'll say, I feel like we have a good way to treat and cure this. This is what we would do if we wanted to do that. If that's not an option, here might be the next step of what we can do to try to fix this. If those aren't options, and if you don't want to keep going, here's ways we can make, Nutmeg feel comfortable until it's time. That's usually what I say. If it's something where I'm like, wow, this is not going to be better, and this sucks, and I'm sorry, then I'll just start with saying, this is not something we can cure, and I'm sorry about that. I wish we could. If we wanted to do everything to try to see exactly how bad it is, if there is, a lot of things we can do to try to keep them comfortable, like if palliative radiation's some type of radiation, or more types of diagnostics to try to get a better view to try to help make them feel better, this is what we could do. However, it's not the wrong decision. I always say it's not the wrong decision to just keep them comfortable, and this is how we can do that. Does that make sense? Didn't that clarify that? Is that okay? Because in my first thought, I was like, oh, I always do this, and then I'm like, yeah, I don't always do this.
Yeah. And then a lot of people were asking about kind of the purpose of sedation before euthanizing. I guess somebody lives somewhere where they don't usually sedate before euthanizing. And thoughts on that?
Death is hard. And you're supposed to, and
painful.
it's painful.
It's painful.
And you're supposed to make it easy. Now, regardless of the fact that, they could put an IV catheter in and just give it the euthanasia solution. Okay. Yes, it is an overdose of a drug. Have you ever seen somebody actually overdose from a certain drug? Sometimes it's not pretty. Sometimes they go into agonal breathing. And you have to remind yourself that you're like literally turning off like the heart and lungs like that. This is still functioning up here.
It's trying to get things
going. So when you sedate them, you already put them into a plane of anesthesia of them being relaxed. They're no longer aware.
They're not conscious to try to fight it.
Right. And then the body passes a lot easier. And sometimes it's a lot easier on the client as well because that patient's already sleeping. If you've ever seen a pet that's consciously awake and then get euthanized, they'll be sitting there and all of a sudden they just melt. They don't fall asleep. They literally just cease to be. And I remember that being one of the hardest things that I saw. And I promised myself I would never see something like that again and always offer that, we're going to sedate first and just ease them through it because pain, like death is a painful process and it should be made as easy as possible on everybody. And it shouldn't just be as a convenience factor or, oh, this is what the drug does. That just basically tells me right there that sometimes those people are not aware of the fact that there's other stuff going on. Just because a drug works, it says the way it works doesn't mean it works for everybody that way.
Yeah, and that was one of the things I had a lot of anger and guilt when my dog Rocky passed away when I was a senior vet student because I just took him to my local family vet and they gave him ACE and then they gave him Euthasol.
Yep.
And ACE makes you kind of whacked out and he was kind of like this and then they turned the lights off on him. And I just remember, besides that, I wouldn't drive by that clinic, which is really inconvenient because it's less than a mile from my parents' house. I wouldn't drive by that clinic for the better part of a year afterwards because I was so angry about it. And I don't think I ever told my mom or my sister what was going on or how it was going on and how wrong it was. Also they made us pay after the fact and they made us feel guilty for coming in that day. Those were the other things. You always do better when you see people do wrong, right?
Right.
But I just remember thinking I know what this drug does. This is not fair to him. Yeah. How is this fair to him? He's dying.
But the package insert says different.
Yeah. So to me, I feel with having done a few euthanasias, that I find that when we sedate them beforehand, the body just relaxes. And to me, that is enough for me to know that I'm doing it the right way because they are not painful anymore. And the actual process of dying is painful, so I don't want them to feel that. That's how I feel about it. Are there any other questions, Sarah? No. We talked a lot today.
We did talk a lot today.
Well, we both have strong views about this. Well, if anybody has any other questions or concerns, feel free to shoot them below this video. Feel free to email us at office@novacatclinic.com, and if you have any specific topics you'd like us to talk about, we're trying to do these weekly.
Put them in the comments.
Stick it in the Stick it in the comments. Thanks for sharing this time with us. Have a great one.